Hi and welcome to my YouTube channel. My name's Dr. Marcus Spry. I'm a private dentist in Maidstone in Kent in the United Kingdom. Today what I thought we would do is to have a look at dental terminology so that you really understand kind of what the dentist is saying when you have your next visit to your dentist. So I guess that we're all fairly familiar. We'll do some close-up shots in a moment, but that we've got the tooth. There's a little model of some teeth here, which we'll look at in detail. And the tooth fundamentally is made of two pieces. The first bit is the top bit, which you can see, which we call the crown. And then the bit that you can't see that's in the gum, we call the root. Okay, so the bit around the tooth, the pink flesh, the skin of that is obviously called the gum. So we've got the crown, the gum, and the root. Now the crown is made predominantly of a very hard material called enamel, and that material is that which you can see on the outside of the tooth. It doesn't have any nerves or any living bit in it. It's a bit like nail or hair. It's without anything that's living at all. Okay, and then inside of that there is a sort of rod of material which is made out of a substance called dentine, and that makes the inner part of the crown of the tooth, and it goes on to make the root of the tooth. Inside of that there's a hollow tube where the nerve lives, and we call that the pulp. Okay, and I'll show you some more close-ups of that in a moment. And then on the surface of the root there's another tissue called cementum, and cementum is the technical name for this layer which connects to the gum, so it's a kind of glue between the root and the flesh of the gum. So those are the structures of the actual tooth themselves. Teeth come in four sorts of sizes and shapes. There's the front ones, which we call the incisors. They're a kind of blade-shaped tooth for cutting the food. And then we've got the canine, which is this sort of daggery one, which is to grip and cut the food. And then we've got the premolars, and they are the smaller grinding teeth, and they obviously are involved in the grinding and the mashing of food. And then we've got the molars at the back, which are the real proper grinders for the pulverizing of your food. All right, so we've got incisors, canine, premolar, and molars. Now, in the States, I know that we have the term cuspid and bicuspid, and basically cuspid is something that's got 1 point and bicuspid is something that's got 2 points. Okay, so that would be the canine is a cuspid and the bicuspid is a premolar, and then we've got the molars at the back which have multiple cusps. All right, so that's the situation there. We'll have a closer look at the model in a moment. Inside the tooth, where the nerve is, that's hollow, and if that gets contaminated by decay, that's when you might need to have a root canal treatment. Coming away from that, if you get a cavity in the enamel on the dentine, you might need a simple filling. Okay, if you're unlucky enough to have a fall and break a tooth, you may need to have the tooth altered to reduce it, and then a capping or crown of porcelain put on, which would then reproduce the shape and the function of the tooth. So that's called a cap or a crown. If you lose a tooth, then you might need to have a denture, which is a removable false tooth, or you might need to have a bridge, which is a fixed false tooth, or an implant, which is a sort of screw-in false tooth. So that's the basic terminology that we can describe without close-ups of the model. So now let's have a look at the model close-up. So here's my model of the teeth for dental terminology. They are a bit frightening, these things, aren't they, when you look at them? But here goes. So this obviously is the crown of the tooth, and there's the root going in, and of course this is the gum here. Ignore this bit. Okay, so turning this round, okay, we have the tooth, and this is the root going in here, okay, and the basis of the root is this stuff with the stripes, which is dentine, okay. The bit on the inside is the pulp, is the nerve of the tooth, and then this white outer kind of sort of crown on the top of the tooth is the cap of enamel, which makes up as I was saying, the crown. All right, now this particular model here, there's been some decay that's got through to the nerve, and the nerve has died and the patient has an abscess, so that would need to have some root canal treatment. And root canal treatment is where we remove the nerve of the tooth. And then in the next one here, what's happened is they've had a root canal filling, and then they've got a metal post and core in, and then they've got a capping on the top of it. Okay, these are premolar teeth here, these two, and then moving along we have a molar tooth here. This particular tooth has a small cavity which has got through, and it's just caused some inflammation in the nerve. So what would likely happen with this is that there might be a little bit of trouble when the patient had something sweet, they get some pain, or there might be a bit of trouble when they have hot and cold things, they might get some pain and they need a visit to the dentist. But hopefully that will just be a filling in this molar tooth here. And this particular tooth here has a silver amalgam filling in it, but also you can see the gum level, which previously was here, has shrunk back. So this has got some gum disease, and this funny looking kind of polka dot area here is where there's been some plaque and tartar build-up, which has caused the gum to shrink back, and that needs to be cleaned away, and then the gum will be able to fasten back on as best as can. So we've got a series of premolars and molars, we've got the root, we've got the crown aspect of the tooth, we've got the nerve aspect. The cementum is a very thin layer on the surface of the root, which then allows these little fibres from the jawbone to the tooth to glue on. All right, and the gum is made of some skin on the surface, which is called epithelium, and then we've got some connective tissue, which is a sort of collagen type of tissue on the inside, and then we've got the bone. This is the blood vessel and the nerve, which comes along into the tooth in a little tiny hole and goes into the nerve. So there's your basic tooth anatomy and a little bit of disease process as well. So you'll be able to understand a lot more now when you go to the dentist. Okay, so that's the close-ups done, and if you'd like to know more about dentistry and dental matters, please like, share and subscribe my channel, and if you'd be kind enough to hit on the little bell, you'll get notification of the next video release. Thank you for watching.